Helen, I'm really excited about having this conversation because I know you've been working on some exciting things that I'm anxious to hear more about. But let's start first, really as a nephrology nurse and an executive over renal services and now working in medical sciences, you've really really committed your entire career to fighting kidney disease. And I'm wondering if you could start off by telling us what hopeful advances have been made in this area of medicine.
Well, thank you very much, Kelly. It's a pleasure to talk to you. I am very excited about advances for people suffering from kidney disease. First of all, there is an added focus on easing the burden of disease and then on quality and safety. It means so much in diseases where the care is often very technical. For
Hmm.
example, dialysis or transplantation. And so quality and safety in those arenas is really, really important. And we see that across biopharma, nutrition, and we know that there are all kinds of advances, including xenotransplantation.
I know you've been working on a very exciting project, and it really represents a major milestone in the care of people with kidney disease. So can you talk a little bit about what your role has been and what has gone to press and the significance that this publication represents?
I served on the board of the Renal Healthcare Association. I'm one of
Yes,
the past presidents.
yes.
And during my tenure on the board, we had a needs assessment. And that needs assessment really drove us to examining what gaps we had in our community. And a really large gap was having a resource for the renal healthcare administrator. Individuals cobbled things together from a lot of different resources, but there was not a single source. As we got into that project of thinking about how we might meet that need, we realized why there hadn't been one. It resulted in consensus development. And so this was an informal consensus development project. Over 100 individuals were contributors or reviewers,
Wow.
2,500 years of experience in the field. It was really something for our community to come together, but also it brings us together as a springboard into other educational material. So it,
Mm.
it will set us in a direction of professionalism. We were excited. We had the permission from the Health Leadership Alliance, and we were able to use their principles and adapt them. So very
Wow.
exciting times.
Wow, that is really great. And in a way, just as a member of the general public, I guess I would assume that those kinds of things exist, but I don't think that it's that uncommon for there to not be that consensus piece. And what a valuable tool in leveling the playing field, so to speak, so that regardless of where you are, maybe you're in a rural community, maybe you're in a medical school affiliated hospital, there's so many different layers of medical care that's available. And this is really an exciting way to make sure that no matter where you're being cared for, you're gaining the benefit of that collaboration of expertise.
It really will begin a new day for all of us, for all of us. And the community that has come together they're very excited. And of course, areas of disciplines have core curricula, such as
Sure.
nurses and physicians. But these are healthcare administrators, and they come from all walks of life. Some have a business background, some have a clinical background, and this way, it really level sets for our community.
Yeah, super important. That is really exciting. Well, As you know, we are in the business of communication, and you have long been a strong advocate of the importance of patient communication in quality of care. So, how is that evident in this new publication of core curriculum that you've worked on?
The name of the first section is Patient Experience and Health Literacy. And that really sets the tone that it is because of this population that we serve as healthcare administrators in the field. And so it is something I'm very proud of. And people with chronic kidney disease contributed to the core curriculum. And one of the real big surprises and a nice added piece is we collected artwork. So there's a ceramic piece, and there are wonderful paintings and graphic design and photograph, and then poems. So it's one of those things that as you are using the reference, it brings you back to why we're all here.
That says a lot too about even the people who were brought together to develop this core curriculum and where their hearts were. I mean, from what I know about you, that made you the ideal person to corral all of this and collect it. For this piece to start off with that patient experience and placing that emphasis right at the start on communication and all that, I think that says a lot too about the impact this is likely to have. Do you agree?
I do. The word that came to mind as we were working on this, among all contributors and reviewers, was really listening, because it was consensus development and sit back and listen. And that ended up being powerful and resonates throughout, this whole core curriculum.
Given what you know, where we've been in fighting kidney disease, and this new core curriculum that's been developed and the influence that you expect it to have on the care of individuals. If I were a person with kidney disease, how should I feel right now about where medicine is in providing me with quality of life and putting me at the center of the focus?
I think that individuals with chronic kidney disease or, acute kidney disease really will benefit from the direction that the community is headed. It's unprecedented that individuals came together to really hammer out, what is most important, and to give some guidance both to the new administrator, but also as a reference for those that have been in the field a long time.
Sounds like you're really on the forefront of bringing into the medical community some exciting advancements. And the word consensus, I just don't think can be used enough. So thank you so much, Helen, for what you're doing. And we look forward to all the future contributions that you make as well.
Thank you, Kelly.